Okay, so my name's Talia Broekers, and my presentation is on queering healthcare, and my pronouns are she, her, hers, or they, them, theirs. When I was asked to speak for this event, I spent maybe 30 seconds thinking about what I would speak about. If you know anything about me, I have three very strong passions: my cat, queerness, and healthcare. But sadly, with the limited amount of time that I have to talk today, I decided to only talk about queerness and healthcare. Sorry, Petal. I knew in 8th grade that I wanted to be a nurse, and within that same year, I realized I was queer. In high school, I continued to understand my own identity and learn about the queer community, still interested in being a nurse, but not really having a passion to mash queer stuff with healthcare stuff because I didn't know much about the healthcare system yet. Since I've been in college, I've been growing more and more in my passions for nursing while also being critical of the healthcare system. I've had the opportunity to learn about other vulnerable populations in our community that can slip through the healthcare system's cracks, like incarcerated persons, neurodivergent folks, veterans, homeless folks, and more. I've grown in many areas, and I've found that I love analyzing queer people in healthcare, specifically transgender people. My inspiration for this talk is thanks to being in an LGBT studies class. Since being in that class, my mind has been thriving on how I can improve the healthcare that queer people receive. What I want to focus on today is the barriers transgender people face when trying to access transition-related care, specifically hormone replacement therapy, or HRT for short. Let's look at a massive study conducted in 2015 that surveyed 28,000 respondents. The original document is over 300 pages long, but don't worry, we're not going through all of it. I looked primarily at the section that asked trans folks questions about their healthcare experiences. Of the 87% of trans folks who got medical care within the past year, only 62% of trans folks had a positive experience with a provider, and 33% of trans folks had a negative experience with a provider, including 24% of folks having to educate their own provider about transgender people in order to receive adequate care. That's a big yikes. Okay, so we can establish that there's a massive gap in the care that trans folks are receiving. But let's look closer into the trans folks who are seeing providers specifically for transition-related care, like HRT. Of those who have a provider they see for transition-related care, only 65% said that their providers seem to know most things about care for transgender people. Another big yikes. Now, one thing that the study didn't ask is who is providing trans folks with their transition-related care, specifically HRT. Doctors have the power to prescribe drugs, and there's a lot of doctors out there. This is where my baby study comes into play, and this is the last of numbers. My anonymous survey is still open for responses, but of those who have taken it, 14 people are on HRT. And of those people, half of them are seeing a family physician or a nurse practitioner. 4 of them are seeing an endocrinologist or somebody who specializes in hormones. And the others are kind of miscellaneous, like one person seeing an OBGYN. Okay, interesting. A family doctor can prescribe HRT to trans people. Why aren't more trans folks getting access? Yes, there's multiple factors like financial problems, insurance stuff, needing a referral letter from a psychologist, etc. And of course, in Indiana, I bet many of you are also guessing that trans folks get denied care due to religious exemption. Yes, that too. The data from my baby's survey supported these barriers, with one person from my survey saying that they had difficulty engaging in conversation with their provider and participating in their own care. When they told their provider that they wanted to increase their testosterone dose, the provider acted as if they were drug seeking and treated them very poorly. Another person from my survey stated that they were denied HRT due to religious exemption, so they decided to do their own DIY estrogen, likely through oral contraception, but they didn't state. I also want to look at another barrier. In my digging, I've looked up the specific medications and types of hormones that are used in HRT, like various types of estrogen, testosterone, and androgen blockers. I've looked at the FDA-approved manufacturers' drug sheets for these various drugs, and I found something interesting. Trans folks aren't mentioned anywhere on many of these drugs, and if they are, they're considered an off-label use. This is because these hormones are approved by the FDA, but they are being used in an unapproved way when given to trans folks. These hormones can be used on cisgender people for various medical conditions, so the dosing recommendations are different for that of a cisgender woman and a transgender woman because the desired effects are different. But because trans folks are considered off-label, I had to find most of that information myself through the University of California's website. Another element is how our doctors and nurse practitioners are being taught. What kind of education are they getting? Probably an education that doesn't include how to care for transgender folks outside the basic names, pronouns, and respect. And although I'm a nursing student and can't prescribe medications as a nurse, I can give medications to patients and learn all kinds of information about potential side effects and patient teaching points. I've learned about endocrinology in my courses, and I've learned how HRT can be used for cisgender people, but not trans folks. I wonder what the education nursing students, nurse practitioners, physician assistants, pharmacists, and doctors are all getting nationally regarding transgender healthcare. I even asked one of my close mentors and professors here at Purdue about HRT uses for cisgender people, as I know she has prescribed it before for postmenopausal women. She told me that she knows how to prescribe and manage those medications, but doesn't have any knowledge about how HRT works for transgender folks. She's open to giving care to transgender folks, but doesn't feel comfortable prescribing something that she doesn't fully understand the uses, side effects, etc. in trans people. Okay, so what can we do? Civically, make sure that you're registered to vote, make yourself knowledgeable about the issues transgender people face, and listen to their voices. If a politician is proposing to pass a law that allows healthcare providers to deny care based on religious exemption, look into how that can negatively impact trans lives. I'd also recommend taking Safe Zone training and the Trans 101 training through the Purdue LGBTQ Center on this campus. And personally, I know that moving forward, I want to explore the LGBTQ healthcare curriculums that exist around the country and see what medical schools and nursing schools are doing locally and see if there's an opportunity to fill the knowledge gap. Moving forward, I want to embrace my queerness and leverage the privilege that I hold by being within the healthcare system. I want to help unite our community and provide exceptional care for all queer folks, especially trans folks. Maybe if we continue to educate the people around us about trans folks and fill the knowledge gap more providers will be knowledgeable, confident, and able to provide comprehensive care to trans folks. Trans folks deserve to be heard and respected. Thank you.